Welcome to the third of 8 webinars in the Project Firstline Infection Prevention Essentials webinar series. My name is Christina Boyd, Director of Quality, Patient Safety and Health Policy at the Illinois Health and Hospital Association, also known as IHA. As we are going through a handful of housekeeping items, we encourage you to please complete the polling questions on the side of your panel that is open at this time. If you are unable to see the polling panel, it is likely because you are in full screen mode. And at that point, you would need to press Alt-Enter at the same time to remove yourself from full screen mode and be able to see that polling panel. Results from this poll will only be seen by the presenters and not shared with other participants on the line. After you selected your answers to the poll, please be sure to click the Submit button to ensure that your answers are received. Before we begin, I do have a few announcements for you. Due to the large number of participants on the call today, all participants will be on mute. We will have a lot of opportunity for discussion and comment during today's breakout session. So to take yourself off mute, you will click the Unmute button on the bottom of your screen. For those that are not on the WebEx portion and are called in on a phone only, you would press *6 to unmute your line. We also encourage you to utilize the chat box in the bottom right-hand side of the screen. And if that's not popping up, again, you might be in full screen mode, so Alt-Enter at the same time. And then the chat box, you can pop open, there's like a little comic book bubble down there at the bottom right. That's how you would get to the chat. Finally, I do want to make you aware that this webinar is being recorded. By attending this webinar, you are considered to have consented to being recorded. If you do not want to be recorded, please exit the webinar now. A copy of the slides and the recording of the webinar will be shared with all registrants following today's presentation and posted to the Chicago Department of Public Health Healthcare Associated Infection website. Again, I want to welcome all of you to the third of 8 webinars in the Project Firstline Infection Prevention Essential Webinar Series. This series is intended for all frontline healthcare personnel, regardless of previous infection prevention or control training or experience or educational background. These sessions will provide foundational knowledge that you will need to be able to confidently apply infection control principles and protocols necessary to protect yourself, your facility, and your community. Today, we will be utilizing educational materials from Project Firstline, the Center for Disease Control and Prevention's collaborative aim to provide infection prevention training. We appreciate all of the great work that you do to serve your patients and communities and are looking forward to connecting with you throughout this webinar series. Today's session is accredited by the state of Illinois for up to 1 hour of nursing continuing education credit. Only those attending the live program are eligible for continuing education. Following today's webinar, you will receive a survey via email. You will need to complete all of the fields in that survey, including entering your nursing license number, that will need to be done by Thursday, May 19th in order to receive those continuing education credits. If there are multiple people in the room with you today, please be sure to forward that survey link to those folks so that they can also complete that survey. Within 2 to 4 weeks following the close of the survey, respondents will receive their continuing education certificates from IHA staff. All participants in today's webinar session will receive a certificate of attendance. The Illinois Health and Hospital Association is partnering with the Chicago Department of Public Health to host this webinar series to support your infection prevention training needs. You will be hearing from these members throughout the webinar series. The Centers for Disease Control and Prevention Project Firstline initiative aims to provide infection prevention and control training for frontline healthcare workers by supporting their efforts to understand and confidently apply infection prevention and control principles necessary to protect themselves, their facility, and their community. There are multiple components of this work, and those include First, to conduct an infection prevention learning needs assessment of frontline healthcare workers in the city of Chicago in an effort to identify training needs and gaps. And many of you likely completed this learning needs assessment for us back in the fall and winter months, and we appreciate your feedback there. The second component of this work is to promote awareness of the CDC Project Firstline infection prevention training curriculum and to facilitate foundational infection prevention trainings using that CDC framework. We know that many of you on the line today are seasoned infection preventionists or have had infection prevention training in the past, and you will no doubt find that this content in this educational series to be basic and truly geared towards frontline healthcare personnel. There will be opportunities for discussion during each one of our webinar series to hear about participants' experience and to learn from peers. We would welcome those with experience in infection control to share their knowledge and serve as mentors to those who are in the early stages of their training. Our third and final goal is to evaluate these training sessions to ensure that they provide meaningful learning opportunities for frontline healthcare workers. With that, we will go ahead and start today's discussion about how respiratory droplets are spread and begin to better understand how SARS-CoV-2, the virus that causes COVID-19, travels between people through respiratory droplets. This slide highlights today's learning objectives. By the end of the training, you will be able to describe at least one characteristic of respiratory droplets, how SARS-CoV-2 is spread, and why it is important for us to work together to keep respiratory droplets out of the air to prevent the spread of infection. In just a moment, I'm going to start off by playing a video for you. So the video sound is actually going to come through your computer speakers, regardless of whether you're called in on your phone or not. So for best audio quality, we do recommend that folks, if you're dialed in on the phone, that you turn the volume down on your phone and then turn the volume up on your computer speakers and make sure that they are not muted, okay? Now, if you do not have speaker capability on your computer, we are going to drop a summary of the video in the chat. We are also going to be posting the YouTube video link in the chat if you need to go and watch that later or watch that on a different device, then you can do so. We're also going to be sending out the link to that video in the follow-up materials. So we do hope that you are able to hear the video if your computer does have speaker capability. Now give me 1 second to play the video. Okay, Dr. Carlson shared a lot of great information about respiratory droplets and how they spread COVID-19. The main way that SARS-CoV-2 spreads between people is through respiratory droplets. Anytime we breathe or talk or just sitting there, we let out tiny respiratory droplets. These droplets are different sizes, and because they can be small and light, there is a chance that if someone is sitting close by and isn't wearing a mask, that person can breathe in the droplets. After hearing from Dr. Carlson about how respiratory droplets spread, seeing an image like this makes us understand why these little droplets matter and why we care about preventing people from breathing in each other's respiratory droplets. We're going to play another video, and if you did not hear that last video, please send us a chat to let us know that you couldn't hear it. But I don't believe we had any issues. So just as a reminder, that sound's going to come through your computer speakers. So you need to make sure those are not on mute, the volume is all the way up, and your volume on your phone is all the way down. Again, we will be posting a summary of the video and sending out links following the presentation for those who are unable to hear today. Give me 1 second. Oh, just 1 second I lost my videos. Just give me 1 second. Okay, so again, Dr. Carlson shared a lot of great information about how viruses make you sick. All of the infection control practices that we have put into place for COVID-19 are to keep the SARS-CoV-2 virus from getting into our eyes, nose, and mouth where it would make us sick. When a virus takes hold in our body, the immune system revs up to fight off the virus, and it is that activity of our immune system that makes us feel sick. And that's where the fever, chills, cough, and some of the other symptoms come from. There are times when the immune system is fighting a virus, but a person doesn't feel sick. And in those instances, a person can still spread the virus. With that, I am going to turn it over to my colleague, Jenny Winkler, also Director of Quality, Patient Safety, and Health Policy here at IHA.
Christina, so much for sharing those videos and talking us through that first part. So in just a moment, we're going to go ahead and split into 4 breakout rooms based on the different care settings that we work in. And then we're going to talk through the questions that are listed on this slide. So those questions are, what is your facility doing to keep people from breathing in each other's respiratory droplets? And which of these strategies are easy to implement consistently, and then which are hard to implement consistently? And we'll talk through why that is a little bit. So each breakout room will have a Project Firstline team member serving as a moderator. We'll have 15 minutes to discuss the questions on the slide. Our breakout rooms are going to be based on the different care settings that we all work in. So we encourage you to join the group that is most closely related to the type of facility that you work in. At the end of the discussion, we'll all come back together. We'll share the highlights from what we've talked about around these questions. We want you to also keep in mind that there might be a variety of healthcare providers with different levels of infection prevention experience in your breakout room. So when we come back, we'll hear about a handful of different strategies that facilities are implementing to prevent the spread of respiratory droplets. So in a moment, you should see a window pop up on the right-hand side of your screen that allows you to join one of those breakout rooms. If that window does not appear, you will need to hover your mouse over the top of the screen. And at the top of the menu bar, click on Breakout Sessions. You'll be able to scroll down to an option that says Join Breakout Sessions, and then you'll select one from the list that appears. If you are viewing the this webinar in full screen mode, you'll have to hit Alt-Enter to exit full screen mode, and you should see the menu bar at the top of your screen where you can click on the Breakout Session drop down. So with that, we'll go ahead and join our rooms.
Okay. All right. Again, everyone, if you are having any difficulties getting into those breakout sessions, there's probably a couple things going on here. You are in full screen mode, and to exit full screen mode, you will need to press Alt-Enter at the same time. That will exit full screen mode, and you will be able to see that menu bar at the top. There is another, if you're not seeing that menu bar, you might need to hover up on top there and click, it might say Show Menu Bar. Once you click on Show Menu Bar, the Breakout Session tab, will show on that menu bar. So on the menu bar, you are looking for Breakout Sessions, and then when you click on that, a drop down will come and it will say Join a Breakout Session. Hover over that and your options will come down. If anybody is continuing to have problems with that, go ahead and let me know, and then tell me what room you'd like to go to, and I can place you there. Although it might get hard to do that if a bunch of people come off mute, but I am certainly willing to help get you to where you need to be. Again, you might be in full screen mode. That'd be Alt-Enter at the same time to exit full screen mode. Anybody having issues getting into their breakout room? I still see quite a few people in the main room here. Yes, Margaret, I will get you into room 3. Thank you. Is your name Margaret on your screen name? Shine wants to go to acute care. Okay. I'm working. I see your chat. I'm getting you guys there. Margaret, is your name Margaret on your screen name? Because I'm not seeing you here, but you might be under a different name. Sabaro, let me know where you'd like to go and I'll put you there. Virginia, which room? Oh, outpatient. I see. Never mind. Anybody else? Okay, thanks, Sabaro. I will put you somewhere. I'll put you in room 1. Hey, Yolanda, where do you want to go? I see you here. You want to go to outpatient maybe, or wherever? I think, let's put you in number 2, I think. Maybe number 4. We'll put you in number 4. Acute care, Donna, I gotcha. Anybody else having difficulties that would like to be in a breakout session? I apologize that we continue to have this problem. We thought we really had solved it. Again, I think the trick is attempting to find the breakout room option at the top of the screen, whether that's being in full screen mode or needing to click on show menu bar. Okay. Okay, I still have Catherine, Diljit, Gail, Leanne, Lori, Maria, Mary Lou, Marty, Minvi, and someone just named Yes. If any of you guys would like to move to a breakout room session, please let me know. And we're going to do this exercise again, one more time. We're going to go into breakout sessions.
like everybody's coming back. Okay, so thank you all for discussing and sharing during those breakout rooms. I know the 15 minutes went by very quickly for us, and so I'm hoping there was a lot of discussion. So really quickly, we'll do a quick round robin to hear about what each of the groups talked about, just a quick highlight. So we'll go ahead and start with group 1. Adam.
Thanks, Jenny. And so our group was the long-term care, assisted living, and home health, the folks from those care settings. And just a few things to highlight. First and foremost, I think one of the comments that came in through our chat was that PPE fatigue is real, and that it's something that is waning a little bit more as the virus has ebbed and flowed and maybe isn't as acute as it was. So that PPE fatigue is something that folks are struggling with. As well as we had another individual talk about the challenge from an employee perspective of physical spacing and folks getting a little bit lax on physical distancing and those 6-foot protocols that were so strong maybe in the first year or so of the pandemic. And then we also had some discussion around the difficulty with some of the patient populations in these settings who might struggle with dementia or other issues that make it really difficult to ensure compliance with PPE and other guidelines. So those are just some of the highlights from our discussion.
The second group, Shane.
Hey everyone, yeah, this is Shane Zelinsik from CDPH. Yeah, our group was the outpatient settings group. And I think, similar to kind of what Adam highlighted, I think we did discuss and find that masks were, currently still being kind of worn as the primary prevention strategy for protecting against the spread of contagious respiratory droplets. Folks are still using sort of clear plastic barriers as well, although some have taken those down. And generally, folks are compliant, but we had some discussion around how to maintain compliance, and someone highlighted that they have their security person in the waiting room will kind of remind people and encourage people to do that, to wear masks, and that sort of thing. We also had some interesting discussion because we had kind of a diverse group on, folks who had daycare experience and family health center experience. So they talked a lot about people not coming to work sick. If someone brings a child who is sick, they're asked to leave. If they have symptoms that are concerning for COVID, they can be tested and isolated appropriately. So, again, I think that just goes back to the whole point of screening. And then finally, we talked a little bit about ventilation. And in a health center setting, they have well visit rooms, as well as sick patient visit rooms that they can close down for a certain amount of time after the visit in order to let the droplets kind of be removed from the air. So lots of good conversation.
Thanks for sharing that, Shane. The third group, Allison.
This is Allison Van Dyne, also from the Chicago Department of Public Health. So our group was actually local and state health departments as well as support organizations. So we had a slightly different setting type and a lot of great diversity in settings. So we had some great discussion. One of the big things, which everyone's kind of mentioned already, is, enforcing PPE use. But one thing we did talk about is how it's a little difficult, especially in our group settings. Because you'll have, we had, for example, a public health nurse who goes into senior youth and behavioral centers. So that, of course, is more healthcare based recommendations, but that can be really difficult to implement consistently because of funding issues, even in some of, like, say, homeless shelters or some nonprofit areas. We also had some great examples of community organizations where it can be a little difficult if you just say have community members coming in off the street kind of as walk-in appointments in person. That can be difficult to enforce masking as well. But really just enforcing, even in office settings, 6-foot distancing, masking, not coming to work when sick, and screening.
And then the last group, Crystal.
Hi, I'm Crystal. I'm from Advocate Aurora Sherman Hospital. The group that I had was acute care hospitals, long-term care facilities, mental health facilities, and also a correctional facility as well. So what is the facility doing to keep people from breathing on each other? Universal masking, social distancing. They're still installing plastic barriers, even between the bed spaces. They're reducing visitors, including having limited visitor times. They're limiting staff in the break room, which we've identified as a major challenge. Even if we take away those chairs, they still kind of reappear out of the woodworks. Increasing the airflow to remove respiratory droplets, increasing those HEPA filters, and hand hygiene, definitely advocating for that hand hygiene. Integrating those screenings, utilizing signage, and some of those strategies that are implemented that are kind of starting to get challenging again is that universal masking because of the fatigue of having to wear that constantly. Why is it so hard with the consistency? Non-compliance is, mistrust with our patients, having mistrust with us, and then we're entering an era that's intruding on our rights. So that was a little bit of feedback that I got from our group.
Thank you so much for sharing. And again, thank you everyone for the great discussion. So in just a moment, we're going to jump back into those breakout rooms really quickly. We're going to have 5 minutes to just talk about the scenario that's listed on the slide. 3 patients in a healthcare facility develop respiratory symptoms within 48 hours. What infection control steps do you take? So we're going to go back into those same breakout rooms, 5 minutes. Again, there should be a pop-up on the right-hand side of your screen. Otherwise, you can hover over the menu bar at the top of your screen where you see the option to select breakout sessions, and you'll scroll down to join breakout sessions and select the room you want to join. So, all right, we'll go ahead and start now.
Same thing, you have to follow the same protocol you did last time. If you need to be assigned somewhere, let me know. I believe most of the folks who had issues last time I've already assigned, so that's good. At the top of your screen, show menu bar, or if your menu bar is already shown, you would click on breakout session. From there, you're going to get a drop down. Please scroll down to join breakout session and select your session. You can also put into chat if you want me to put you in a particular room. I'm happy to help. Gotcha, Glenda. Bridget, gotcha. Hey, anybody else who would like to be assigned, just say, put the number in the chat and I'll get you to where you need to be. Gotcha, Jean. Sorry for the difficulties. Gotcha, Noel. Break room. Which break room, Noel? Which number? Gotcha. I'm sorry. No, we're sorry. I apologize, Carol. We will get you to 4. Anybody else wishing to be placed, just go ahead and drop just all you really need to do is put the number in the chat, and I know where you need to be. Gotcha, Kendall.
So I know that 5 minutes went by really quick, but I hope everybody had an opportunity to talk a little bit about this scenario. So we'll just go real quick to hear a couple of things that each of the rooms talked about. So we'll start again with Adam. Oh, and I think you're on mute.
Sorry. So briefly, long-term care, assisted living, and home health group. It's kind of our top 5 were letting staff know so they're aware, immediate implementation of isolation protocols, creation of a quarantine unit if possible, rapid testing for the individuals to rule out COVID, and contact tracing for the last 48 hours for those individuals who've been identified. So those were the handful of things that we came up with.
Shane.
Jenny, sorry. So yeah, we talked just a little bit about, you know, in certain settings they would, if have patients tested for COVID, if they just to verify the diagnosis. On the employee side, so we kind of, changed the prompt a little bit, because on the employee side we talked about, connecting positive employees with employee health to be seen and have COVID ruled out or ruled in. And then if they were positive, excluding them from work for the appropriate amount of time. Other, facilities just commented that they, screen folks regularly, and would need to obviously do that if they had, some evidence of transmission. And I just mentioned that there was, on the health department side, we would kind of investigate cases for commonalities and Ppe linkages. So that was a group.
Yeah, perfect. Allison.
We had some great discussion. So I want to say sorry, Margaret, you got cut off right in the middle of making an excellent point. We did have a great example from Taylor where a volunteer tested positive in one example, and just quarantining all who were exposed, making sure anyone who may not have been exposed was still wearing proper PPE. Margaret had a great example about with site visits to a healthcare facility where you're making sure that, kind of as Shane mentioned, if there's any commonalities. So obviously you would go right into your isolation and quarantine procedures, making sure, EVS staff are cleaning thoroughly and really looking for any commonalities, and that kind of applied to all of our other settings too, where if you have 3 people who develop respiratory symptoms, see if they're connected, see if they had any exposures together, if they're from the community, see if there was potentially a community event, and just kind of trying to trace to see if it's an outbreak or if it's just high community transmission.
And Crystal.
For our group, we identified, contact and droplet isolation needs to be implemented immediately. We want to begin that investigation with testing on those patients to see what they've got going on. We want to create a line list, notify our RD team and our infection prevention team. We want to implement and make sure that our staff have that PPE readily available. And I love it when we have an epidemiologist in the group, because she was like, get out an epi curve. So I love it. Again, we had others that, they shut down the unit while they're doing their investigation and increased screening.
Thanks, Crystal. So we're going to go ahead and just wrap up these last couple minutes here. This slide just highlights some of those key messages that we talked about today. I'm not going to read through all of this, but hope you have learned some information about respiratory droplets and how SARS-CoV spreads through respiratory droplets. This slide highlights the upcoming sessions that we have scheduled. And the broader themes of the Project Firstline materials. So there's a link to register for future webinars that you're welcome to pass along to your colleagues. And as you see, the information in these sessions really is geared towards those frontline healthcare workers. So we encourage you to share these opportunities with those staff. This slide highlights the Project Firstline materials, but also want to include the website for the Chicago Department of Public Health, where you'll find additional healthcare associated infections resources and the recordings for all of these webinars. We want to thank you all for participating today. If you have any questions, would like information about what we've talked about, or would like to partner with us at the Project Firstline team, we encourage you to contact this email address that's listed here, the infectionprevention@team-iha.org. And then lastly, before you sign off today, we ask that you complete the poll that is open on the right-hand side of your screen. The results from this poll will only be seen by presenters and not shared with participants, but the results from the poll will really help us to improve all of our future education sessions. Also, for those seeking nursing CE credits, you can scan the QR code that's on your slide now and complete the information in the survey. If you're not able to complete that survey at this time, a link will be sent to participants following today's presentation. So thank you all again. We appreciate all of your time, all of your efforts, and hope you have a great afternoon. Thanks.